My name is Matthew Otten, or Dr. Otten. I've been practicing private practice sports medicine for the last 10 years, and I'm fellowship trained in sports medicine. I also have been an associate professor for the last 10 years, teaching these procedures to residents and students. So I have a fair amount of practice and a fair amount of information to share in these next slides. So why is regenerative medicine important? The reason why regenerative medicine is so important is because it's a booming industry. In 2019, we had about $13 billion worth of revenue in regenerative medicine procedures. That number is expected to increase about 300% to about $40 billion in 2024. So this is a real field, and this is a big field that a lot of people are now becoming interested in. Next. Thanks. So the most common procedures that we typically see in our clinics are PRP, which everyone knows about, that's platelet-rich plasma therapy, bone marrow concentrate, or BMAC. This is where we harvest stem cells, mesenchymal stem cells from the bone marrow, prolotherapy and ozone therapy. This is really big in Eastern Europe and Europe in general. This isn't as big in the United States. Then we have adipose tissue as well as stromal vascular fraction. I think is a general recommendation here in the United States, and we do have international attendees to this meeting, so I won't necessarily discuss international compliances. But within the United States, I would not recommend doing stromal vascular fraction. But adipose tissue is allowed in the United States, and that's what I'm going to focus on in this particular webinar. We also have another compound called A2M, or alpha-2 maculoglobin. And the big thing that we need to talk about at some point in time, and you're more than welcome to ask questions about this, is the third-party products. These are the umbilical cord stem cells, the exosomes, the Wharton's jellies, the et ceteras. As a general rule of thumb, in my practice over the last 10 years, most patients want their own tissues transplanted or autologous tissue transplantations. I think is a recent thing that's been happening though, in the last 3 years, there's been a huge influx of private equity money into these third-party products. And so they've had a lot of marketing behind them. So in the last 2 years, 2 or 3 years, we've really seen this upswing in these third-party products. But in the last year, in my personal practice and talking to the general public, as well as my colleagues that do a lot of regenerative procedures, the pendulum has swung back, and patients are more and more interested in having their own tissues transplanted. And specifically, adipose tissue, I think, is one of the biggest one in my clinics that I get requests for. And one of the reasons why is if you Google Livion, this was a product that was out there recently. If you Google that, there's been a lot of bad press and complications associated with these products because there's very minimal FDA oversight with these. So, all right, so we'll go on to the next slide. So let's talk about what we're all here today for. And this is adipose tissue transplantation. This is by far my most requested procedure in my clinic. I also have found that it has typically, as a general rule of thumb, the highest success rates. So I define my success rates as an improvement of about 50% or better. Most of the times it's a lot better. It tends to be 70 to 80%. But as a general definition in my clinic, if you have 50% improvement from the procedure, I consider that a success. So knees, I typically get about an 80% success rate with these. And in 2019, there was a multi-centered study performed in Emory University that showed a success rate of 73%. So there's really good data behind these procedures now. Shoulders, as a general rule, I get about an 80% success rate. Hips and ankles are slightly less at 70 and 60%. Now, the reason why I have a little bit less success rate in hips and ankles is people present late in the stage with arthritis. Most patients, if they have mild knee pain, they'll present. So if they're 40, 50, 60 years old and they have mild knee pain or shoulder pain, they're going to present to the office for a procedure. Whereas for some reason, hips and ankles, patients present late in the game. So I usually see advanced osteoarthritis in both the ankles and the hips by the time that they present and want a procedure. And obviously, if you have significant or advanced osteoarthritis, the success rate of these procedures decreases. So on the next slide, why do I like fat versus bone marrow? So now we're going to focus on autologous stem cell transplantations. And the reason why I like adipose tissue so much is the concentration of mesenchymal stem cells in the adult patient maintains a consistent high level. Whereas in bone marrow, as we age, the stem cells tend to decrease. This slide is also important because these third-party marketing groups utilize this slide to try and sell their products, but they never show the adipose tissue because obviously that would be terrible for their marketing. So the reason why I like it, and this is important, because adipose tissue maintains a high concentration and a high viability of mesenchymal stem cells throughout our adults' lives. On the next slide. So the whole goal of these procedures is to reduce pain, and that's a multifactorial answer, which I'm more than happy to get into, but we can save that for the end of the lecture because it's such a long answer. You also get to transplant adult or adipose-derived mesenchymal stem cells. As a general rule of thumb, for every procedure that you perform with adipose tissue, you get anywhere between 200 to 500 million mesenchymal stem cells per transplantation. The other thing with adipose tissue stem cells is they have the ability to replicate 8 times before differentiation. So if you look at bone marrow, on the flip side of the situation, you get far less stem cells and they only self-replicate 5 times. So with adipose tissue, you get a huge volume of stem cells that have the potential to replicate 8 times, giving you an even larger number of ultimately the cells that you're looking for, such as chondrocytes or cartilage cells. And the goal of these is really to repair and regenerate orthopedic structures and tissues. And as a general rule of thumb, what I typically tell the vast majority of my patients, because it's well documented, is that the procedure, if you have a successful procedure, which the vast majority of patients do, typically the results will last about 3 to 7 years. What I like to tell people is, if we're able to regrow some of this articular cartilage, I can't change time, but over the course of a year to a year and a half, those structures will regenerate and you have a new baseline. And then the aging process begins again after about 18 months. So on the next slide, this is, okay, so if you're gonna take anything away from this whole lecture today, this is the slide to pay attention to. So I'm gonna talk about tumescent fluid and liposuction in general for just a minute, and I'm gonna take a step back. So typically in liposuction procedures, we have to inject tumescent fluid. Tumescent fluid is normal saline, lidocaine, marcaine, epinephrine, and a little bit of sodium bicarbonate. The problem with tumescent fluid is twofold. One, you have to expand the tissues a fair amount. So you typically use anywhere between 2 to 3 liters of tumescent fluid to actually inject into the fat prior to aspirating it or performing a liposuction. The other big problem with tumescent fluid is time. These procedures take time. And once you inject the tumescent fluid, you have 15 minutes of injecting the tumescent fluid, then you have to wait 30 to 45 minutes for that tumescent fluid to actually take effect. So you're looking at anywhere between 45 minutes to an hour for the full liposuction to be performed. So that's tumescent fluid. So now let's go on with what the big companies that are floating around out there that are utilized in adipose tissue transplantation in regenerative sports medicine and orthopedic procedures. The first one is Lipogems, and I start with this one because it's a very well-known product. Lipogems has been around for about 10 years. It's developed in Milan, Italy. It is a very expensive single-use kit. It's very easy to use. It's very user-friendly. But these procedures take time. You have to inject tumescent fluid, you have to do the lipo harvesting, and then you have to prepare the fat. They run about $1,500 per kit. So every single time you do it, you have to spend $1,500. And the procedure oftentimes takes about 2 hours in a general whole. Sometimes those procedures can take upwards of 2.5 hours, depending upon how the patient's habitus, meaning are they fat, are they thin? If they're thin patients, it takes a long time to perform these procedures. And I utilized the LipoGem system for about 5 years, so I'm more than willing to answer questions on it. The next big company that's out there that we can utilize is a Tulip system. Now, there is a little bit of controversy currently in the US with the FDA regulations, whether or not the Tulip system actually utilizes minimal manipulation. So I'll leave that till the end too. But the same thing with the Tulip system is you have to utilize tumescent. So your time automatically increases to about 1.5 to 2 hours per procedure. And that cost runs about $500 to $1,500 per procedure. The next one, which I'll discuss later, and this is the one that everyone's here to listen to, is the water-assisted lipoaspiration from Carestream. And this is actually the product or device that I utilize in my clinic. This product takes minimal time because no tumescent is required. And each procedure runs about $300 to $400 per procedure. Everything that I've discussed here and above, all these systems, I've always stressed the importance of single-use devices, and I dispose of every device after every patient. And the reason why I really do this is protection. You need to be very careful with these. You don't want to leave yourself exposed to any sort of potential side effect or adverse event in any of these procedures, because patients are paying for these procedures out of pocket. Conventional liposuctions obviously require tumescent, and the prices can range widely. I do not recommend utilizing conventional liposuction machines because of the destructive potential that they have on the adipose tissue and the connective tissue. And the adipose tissue and the connective tissue is really where those stem cells are held, and that's the whole point of these procedures. So I would implore you not to utilize conventional liposuctions. So let's carry on here, but that's the big slide that everyone wants to come back to. So this is your big slide, everyone. So let's carry on to the next slide. So, and let's now begin to focus our efforts and focus our attention on what I utilize in my clinic, and that is the Carestream Body Jet Eco. So this is a water-assisted fat harvesting liposuction machine. It utilizes low pressure to remove the adipose tissue and hydrodissect the tissue. You can either get a large volume of adipose tissue or you can get a small volume. You can vary how much you take depending upon what procedure you're going to perform. And the biggest thing with this is how quick and easy this thing is. Literally, you are done. Once you make the initial incision for the aspiration of the adipose tissue, you can literally be done in about 20 minutes. And that is not an uncommon number for me to be done and finished with the liposuction within 20 minutes. So the other benefit about this on the next slide, what you'll see is that it comes in two separate sizes. You can get a larger cannula and a smaller cannula. In this particular slide, this is the larger cannula. And so this harvests micronized fat ranging anywhere from 500 to 900 micrometers. And that's about the size that we want, because that's about the workable size that you can get for transplantations with either 20 gauge, 18 gauge, and sometimes a 22 gauge needle. They also offer, I prefer this particular device and this particular cannula size. I find that the larger cannula, the 3.8 millimeter, tends to give me faster adipose tissue harvesting, and it tends to give me a larger volume of adipose tissue. They also offer a smaller one on the next slide, which is 3.5 millimeters. This is really good if you want to be exquisitely gentle on a patient, have minimal downtime, and only working on one joint. So as a general rule of thumb, I tend to use, excuse me, a little bit of a larger cannula size so that I can harvest adipose tissue faster and get a larger volume of it. So on the next, this is a little trick that I figured out myself too, and I just wanted to put this in here so that everyone has the knowledge of this. What I use, sometimes you get a little bit of fibrous tissue after the aspiration of the adipose tissue. This, if you use a female to female lure lock and utilize 2 syringes and push back and forth through this female to female lure lock, you can break up that fibrous tissue really easily, really simply, and very cheap. These things are like 25 cents. So for the international clients, these things are less than $1 US, and it's very cheap and very effective to break up some of the fibrous tissue. And I really focus on cost effectiveness with all of these procedures, because these procedures can get very expensive for us physicians performing them, and ultimately we have to think about the bottom line and the profit margins in these procedures. So on the next slide, so we can utilize this. This machine is good because it has multiple different facets that we can use this in. We can use this in plastic surgery or aesthetic procedures. And then we can also use these in regenerative medicine procedures. So not only can you use this machine in regenerative orthopedic and spine procedures, but you can use this for plastic surgery or aesthetic cosmetic procedures as well. And on the next slide, so this is a good example, and I always like to show pictures. So now what we'll do is we'll transition to some pictures. So the reason why this works so well and so fast is because you do not need tumescent in these procedures. There is a small tip on the head of the cannula that creates that stream, that low pressure stream, which breaks up the tissues. And below that, the larger fenestrations are the harvesting fenestrations that actually bring the adipose tissue in. So you perform everything at the same time. You inject the tumescent through the stream, you break up or hydrodissect the tissues through that stream, and then you aspirate at the same time. On the next slide, there's a small diagram showing this. So on the left-hand side is normal tumescent. You have to inject 2 to 3 liters of tumescent fluid, and then you have to wait 30 to 45 minutes for that to actually take into effect. The problem with this is, number one, time, and number two, it creates the mechanical forces actually can damage some of the tissue. Whereas on the right-hand side, utilizing the water-assisted lipoaspiration or liposuction, everything is done at the same time. There's no waiting time. You use a very small amount of fluid. I usually typically use anywhere between half a liter to 1 full liter in larger cases of tumescent fluid. This also minimizes connective tissue destruction. And we have a lot of clinical data that we can back this up with as well. So on the next slide, this is the actual product itself. You get wonderfully beautiful micronized little tiny fat globules, and these are almost ready to be transplanted immediately afterwards. This is a wonderful example. This is literally how it looks like in your clinic. This machine, and the first time we used this machine, my partner and I were working, and we were absolutely astonished at how fast and how easy this machine was, because we had been utilizing the LipoGem system prior to this. So on the next slide, this is okay, so now we're going to transfer, and I'm going to start adding in patient satisfaction. People pay money for these procedures. These procedures can run in the United States. I'm not sure of the international cost, but within the United States, these procedures can run anywhere from $6,000 to $20,000, depending upon what you're doing and how many joints you're doing. On the left-hand side, this is a classic example of injecting tumescent fluid. You get a big, boggy, you get big, boggy tissues. Patients leave looking like this, so they're never happy. Whereas on the right-hand side, this is literally what you do. You inject a small wheel of lidocaine, you make a small incision, and pass the 3.8 millimeter cannula through all at once. And you're not injecting tumescent fluid. So the downtime is far less than conventional liposuction, which is critical for patient satisfaction, because these are basically plastic surgery procedures in orthopedics. You want happy clients. You want minimal downtime, minimal pain, and you want happy clients. So on the next slide, this is a before and an after picture, and this really drives my point home that I found so useful, and my patient satisfaction increased exponentially, meaning it went up a ton after I started using the CareStream device, the water-assisted lipoaspiration. The top two pictures are water-assisted lipoaspiration. The bottom two pictures are conventional liposuction. So the bottom two pictures demonstrate the modeling effects that occur with the epinephrine utilization. This is concerning to patients. Patients are always concerned about that modeling after the procedure, and you'll get many phone calls about that. You also have that big, boggy, swollen tissue from 2 to 3 liters of tumescent fluid, which takes a good 24 hours to reabsorb and flatten out. That also decreases your cosmetic outcomes as well, I think, in my personal practice. And the after effects from conventional liposuction, you have a fair amount of complications, such as hematomas or seromas. In all honesty, since utilizing the water-assisted lipoaspiration in my procedures, I have not had those complications occur. And you can really see the difference between the top pictures and the bottom pictures. The top pictures show virtually no swelling or fluid retention in the adipose tissue and virtually minimal hematomas, seromas, or ecchymotic changes, meaning bruising changes, because outcomes and good outcomes, good cosmetic outcomes are pivotal to your practice and your practice's success. So on the next slide, this is the old frog slide, which is true, which is totally true. Patients are paying money for these procedures. They want low risk with minimal or no general anesthesia. They want low pain scores both during the procedure and after the procedure, and they want to be comfortable after the procedure. They want their downtime to be 48 hours. As a general rule in my practice, what I've seen is if patients have more than 2 days of downtime, they're probably not going to undergo the procedure. And this product has given me that 2-day window where it's perfect. I've also done this procedure myself. I did this wide awake so that I could tell my patients how it was and what the procedure was like. The worst part of the procedure for me was the actual lidocaine injection to numb up the incision sites. The actual aspiration with the device, I rated it as a 3 out of 10. It was mildly uncomfortable. I was quite surprised at how little pain it actually caused. So on the next slide, so now we're going to shift over to a couple clinical things because we're physicians, we're all clinicians, we all need clinical data behind what we do. If you look on the left-hand side, this is conventional liposuction, and you can clearly see from the pathology slides that there's significant destruction of not only the fat cells, but also the connective tissues as well. Whereas if you look on the right-hand slide, which is the water-assisted lipoaspiration, it's been well documented that we have 90% viability in adipocytes or fat cells, as well as the connective tissue. And that's important for 2 reasons. Number one, on the adipocytes, there's actual adipose-derived stem cells that actually sit dormant on the fat cells. The second place that the stem cells lie is in the connective tissue strands. So there's 2 locations where the adipose-derived stem cells actually lie, on the fat and the connective tissue. And so you have to maintain the integrity and the viability of those structures in order to have viable adipose-derived stem cells. The next slide, if you also want to, is more clinical data backing up this particular product. And you're more than welcome to ask Larry for this. We have over 40 studies and publications worldwide that demonstrate how effective and the safety and the viability of the cellular content from the stem cells. So go ahead, Larry, we'll go with the next slide. So here's one specific case that I did. I always like to show a couple pictures with this in my own clinic. This was a adipose-derived transplantation of stem cells actually into the Achilles, and this was a post-op injection. This gentleman was in the UFC. I won't use his name, but he had a surgical debridement of his Achilles tendon, and he lost his explosiveness, basically the ability to jump at a high level or compete at a high level. And the UFC is a professional mixed martial arts league, which I think most people are probably familiar with it now. But this gentleman was, after the procedure, he was back in the gym 24 hours later, which I did not want. I told him, give me at least a week, but these guys tend to be high-level athletes and they get back into it fast. He had, within 6 weeks, he had noticed significant reduction in pain. And within 3 months, he had booked and had competed in his fight. And he actually won that particular fight. Again, I won't say names in these, but it really demonstrates, but this particular case demonstrated how fast and how easy it is, and your recovery times. Recovery times tend to be very fast with these procedures. So this also shows that we can do these procedures not only on joints for arthritis, but we can do them on tendons and ligaments and any other major structure from an orthopedic standpoint. I tend to do these on rotator cuffs, these procedures on rotator cuffs, Achilles tendons, patellar tendons, as well as major joints. So next slide. So let's leave this open, because I always try and leave at least 30 minutes open to questions. If anyone has any, I am available for 30 minutes to answer both professional questions in my clinic as well as research associated questions.
Thank you, Dr. Orton, for your excellent presentation. A couple of